Hello friends, welcome to a new lecture today on pneumonia. As we all know, what is pneumonia? Pneumonia is a consolidation of the alveoli or infiltration of interstitial tissue with inflammatory cells. So, normally in the past, pneumonia is mainly classified into two types. One is community acquired pneumonia and the other one is hospital acquired or ventilator associated pneumonia. Now, let us first learn about the pathophysiology of normal pneumonia and then we will learn about each type of pneumonia and its classification. So first, in the pathophysiology, before we go into the pathophysiology of pneumonia, let us learn about the mechanical factors which are contributing in the pneumonia. Okay, this is the nose, okay, and then here this is the mouth, and here you'll have this is the nostril, and then you'll have nasopharynx. Okay, this is the uvula. Okay, not here, it's somewhere here there'll be uvula. Okay, this is the nasopharynx, then trachea. Okay, okay, and then you'll have bronchi, and then you will have lung. It is just in diagrammatic picture to represent, it's not anatomically correct. So here there are many factors which will stop the organism to enter into the lungs. First, in the nasal mucosa. So if you know, this is the nasal mucosa. So in the nasal mucosa we have hair. Okay, the hair, and there are turbinates. These will capture the large particles. If this is the foreign particle, this will capture the foreign particles and thus stop the foreign particles from entering the lower respiratory tract. Okay, and then the one more thing is the tracheobronchial tree. Even this tracheobronchial tree have the mucociliary epithelium. The tracheobronchial tree has the mucociliary epithelium. This mucociliary epithelium also traps the organisms and prevent the organisms to enter the lower respiratory tract infection. And one more thing, whenever the any particle it enters through the nostrils or through the mouth, some irritative material, so that will cause that will irritate the uvula, and that will lead to gag reflex. Okay, so this gag reflex also, this gag reflex also protects us from aspirating the fluids into the thing. Whenever that fluid, instead of entering into the esophagus, if it enters into the trachea, if it tries to enter into the trachea, then there will be gag reflex, and thus the person coughs, and thus the aspirated material will also come out. Okay, so this is one of the protective mechanism. One more protective mechanism is in the lungs. In the alveoli, in the alveolar cells, we have some material. Think that this is an alveoli. So when I zoom it out, we have in the alveoli, okay, we have macrophages or some phagocytes. So these macrophages or phagocytes, they will ingest the foreign material and thus prevents the entry of this microorganism or activation of this microorganism. So these alveolar macrophages, they will ingest and thus digest the foreign material. So any microorganism. So there are many protective mechanisms. Then how is the organism entering the lungs? This is because if the organism has passed all these mechanisms, even then we have macrophages. Whenever the macrophages are less, if the macrophages are less than the pathogen, that is, the amount of pathogen entering the lungs is more when compared to the macrophage amount, so that is the stage when pneumonia occurs. That is when the macrophages capacity to ingest is less than the pathogens. So pathogens are so more, they are large numbers that they they will outnumber the macrophage capacity. So this leads to pneumonia. Okay, once the alveolar macrophages, once the pathogen enters, this pathogen will lead to inflammatory response. So what does this do? This will activate the so what inflammatory response does it give? So this will activate some inflammatory mediators like interleukin 1 and TNF. If interleukin 1 and TNF are activated, this leads to fever. If interleukin 8 and granulocyte colony stimulating factor are activated and neutrophils are activated, so all these leads to increased leukocyte count. Okay, and this also causes purulent secretion. So these are the different this is the pathogenesis for pneumonia. So whenever the microorganism is there, there is one more thing that happens, that is the blood vessels are constricted. So this constriction of blood vessels will also cause hypoxemia, thus the person will have dyspnea. And one more thing is there is capillary leak. So from the capillaries all the fluid leaks out. So whenever the fluid leaks out, this will fill the alveolar membrane. If this is the alveoli, this is the thing, the fluid leaks out and it fills the alveolus. So whenever the alveolus gets filled by the fluid, okay, this will leads to increased respiratory drive, because there is V by P mismatch, that is ventilation and perfusion mismatch may be there. So because of this we have dyspnea. Okay, once the pneumonia becomes severe, the dyspnea becomes so severe. Okay, so these are the different this is how the pathogenesis of pneumonia is. In our next class we will learn about the classification of pneumonia. So thank you guys for watching my lecture. If you have any doubts, please comment it in the comment section. If you feel something is inadequate in this lecture, even then comment it in the comment section. Thank you for watching my lecture. Thank you.